Good day everyone, I am John Queen G. Enriquez, Section 12F, Group 2, and a student nurse from Davao Doctors College. And today I am going to perform hand gloving for my return demonstration. So before we start, let us know first what is the importance of hand gloving. So, the use of gloves reduces the risk of contaminating the healthcare workers' hands with blood and other bodily fluids. And it also reduces the risk of the transmission of microorganisms from the healthcare workers to the patient and vice versa. So before we start, we'll make sure that there are no artificial extender or artificial nail and check the hand if there are any source of cuts or any open lesions. So I have none. So before performing the procedure, I have performed thorough hand washing. You must remember that the use of sterile gloves does not replace hand washing. And so we must perform hand hygiene before and after every procedure. Okay, so I prepared here my sterile gloves. Ensure that the gloves are of the right size and that the packaging has no tears or stains. And it is important to ensure that the gloves fit well to ensure users' comfort and avoid also contamination. If the gloves are too big, then it would be harder to hold objects and it would be easier for germs to get inside the gloves. Now, if the gloves are too small, then it is most likely to get ripped, or if not, it may cause decrease in blood flow to the fingertips and may result to pain, numbness, and constraints in fingers and hand movements. So here I have my glove. And now I am going to remove the outer wrapper. So I'll remove it. So this is the outer wrapper. Do this carefully by peeling off the slides. So we'll just peel off the sides, and be careful not to spill the inside contents because this is to keep the sterility of the gloves. Place it on a clean, dry, flat surface because moisture can contaminate the gloves. So now we will place it in a clean and dry surface. And after that, we must always know that the area must be at the waist level. So let us imagine that this is in my waist level because my table is too short. And we will now identify the left and the right glove. So this is the right glove and this is the left glove. And for easier application, we must glove the dominant hand first. So since I am right-handed, I am going to glove my right hand first. And to do this, I'll have to grasp the cuff of the glove here. And it is important to remember that with bare hands, you can only touch the inside part of the glove to avoid contaminating the glove and ensure its sterility. We will now grasp the inside of the cuff like that and glove the right hand. Okay, and after gloving my dominant hand, now I am going to glove my non-dominant hand, which is the left hand. Okay, so now that I'm done doing gloves on my dominant hand, now I'm going to glove my non-dominant hand. And to do that, I'll have to slip my fingers beneath the cuff like that and slip it to my non-dominant hand. Just going to get it. Like that. And okay, so since both of my hands now are gloved, I can arrange it. Okay, so after doing that, we are going to clasp our hands in front of our body. This is done to avoid accidental touching of non-sterile objects and the front of our uniforms. Now, we are going to remove our gloves. All we have to do is to first remove the glove of the dominant hand. So this is my dominant hand. by pinching the glove at the palm area of our hand and remove it. After removing it, we will put it in the other hand. And okay, for the non-dominant hand, we are going to slip our fingers under the glove or to the under our glove or to the inside of the glove and remove it like this. Okay, and put it here. And now you can discard this glove. So after removing the gloves, we will do hand washing afterwards. So that's it for my hand gloving return demonstration. Again, I am John Pinji Enriquez. Thank you and goodbye.